Peripheral nerve stimulation is becoming a big part of our practice because we have so many patients that want to get pain relief without opiates or without any kind of drugs. They want to get to the point where they can control their own pain, and I think that's remarkable. So one way we've been doing that is by treating with what's called peripheral stimulation using StimWave. Now, StimWave has lots of indications, and so you can send patients to me with different kinds of pain, and I can sort them out as far as what would be the best location of a stimulator for them. But in short, if there is a nerve that's giving somebody a problem, we can put a stimulator on it and they can get relief. So in contradistinction to the old stimulation models that you've seen in the past, there is not an internal battery that's necessary with this. What makes this a cool device is that it actually has the receiver in the lead, and then it has a transmitter that's worn externally to communicate with that lead through Bluetooth to cause the patient to get their stimulation. So what are some main causes we treat? Well, we like to treat this the shoulder with this. So to do that, we use a suprascapular nerve approach on the back. We can use the back as a traditional stimulator would be done. It's just it would be a patient that doesn't want to have a battery implant. They would have the same transmitter as the peripheral stimulators we're talking about. It can be done for the knee, for the geniculate nerves, which is another indication. People have osteoarthritis in the knee or pain, or have had multiple surgeries, or they are overweight or not good surgery candidates, or even people that have had total knee replacements. We can also treat the nerves in the arm, from the median nerve. I've done the posterior interosseous nerve. You can do the ulnar nerve. There's lots of different ways to treat the arm. And so what we do in this case is we either use a fluoroscope or an ultrasound to guide the lead against the level where the nerve is, and then we stimulate that nerve to give the patient relief. And again, if this was an arm, for instance, what they would do is they would have an arm sleeve like an athlete would wear, and they would stimulate their nerve whenever they wanted to give their pain relief. And so what it's doing is it's giving people a chance to kind of take some of their pain back. People that have hip pain, we can do the superior or the middle cluneal nerve. So we have pretty much a treatment for any nerve, but these are some of the more common ones. So if you're thinking about patients that have peripheral neuropathy, or they have a real specific nerve pain, or even just an extremity that's hurting them or their back, they may be a good candidate for StimWave.